there is no way that I could live up to the terrible thing that you have created for me. Like, there's no way. Whatever you didn't sleep last night about,
yes,
I'm not going to do that to you. You made that, you tossed and turned all night dreaming of this dental appointment, probably just a filling or something, right?
yeah.
But to them, it was like something terrible is going to happen. I'm not going to live up to that. I'm not going to do that. Half the battle is just getting people to come because they're so afraid. They've already imagined all the terrible things. They're not even going to give it a chance, you know?
So welcome back to the If I Don't Laugh, I'll Cry show. I'm Christina Johnson, and today I am so excited to welcome our very special guest. This is Miss Dr. Tamisha Dennis, and I had already mini introduced her on the previous episode. I told you we met at the Boss Babes brunch, and I said I wasn't going to say a word more so that everything else will save it for this podcast episode. So Dr. Tamisha Dennis is a graduate of the prestigious University of Pennsylvania and has been mastering dentistry in South Florida for the last 15 years. She would describe herself as a dental patient educator, spiritual dentist, and dental conversationalist. Dr. Tamisha, welcome to the podcast.
Hi, Christina.
So I would like to give a little background to the audience. So we initially met at the Boss Babes brunch a few weeks ago, and out of a room of probably over 40 women, we sat next to each other.
I know.
And
isn't that crazy?
It's all I can say is it's incredible. My right ear literally like twinkled when I heard the word dental, and I stopped my conversation.
Perfectly law of attraction at work, like perfect.
It really, yes, there is no coincidences. We were meant to connect, and I'm so happy to have you here. You are my first dentist, my first dental professional on the podcast. So
I'm really happy about that too.
We're going to have such an amazing conversation. I'm so excited to learn more about you and your business.
Yay. I'm so excited to be here. I've never been on a podcast. I love to talk, so it's easy for me to talk. However, I've never done this, so I'm like, ooh, I don't know what to expect. But you've been so gracious, and like just everything that you talk about is just right up my alley in terms of work. And really, as dentists, we don't really get to talk a lot. I know that sounds strange because we talk all the time, but we don't really get to talk about the profession or talk about it from an outside perspective or from a professional perspective, which is that unique perspective that you have.
Absolutely. And it's true, like you said, you don't really get to put your voice out there. It's, you know, you're in the office, you're working with your patients and your team members, but what about the rest of the community, the rest of the world?
It's really like go all the time. So it's getting to slow down and really kind of, for lack of a better word, philosophize. And really talk about like what's really behind the thought process of, you know, well, my thought process at least, and just dental health professionals in general. It's really different and interesting, and I like it.
Oh my gosh, it's so true. It's so true. So just let's kick it off with, why did you decide to become a dentist?
You know, it's so funny. You sent me that question, and for a second I said to myself, I don't like answering this question, because I always feel like when you go to dental school, everybody makes you do like a professional statement. I'm pretty sure even for hygiene, you have to do like a personal statement or mission statement. And everybody likes to write these long statements about how they were riding their bicycle one day and then they broke their teeth and they went to the dentist. And then, I hope that's not your story, but they went to the dentist and they started loving dentistry. I don't have that story at all. My story is very uninterested. When I was 12 years old, I went to the dentist for a first time, and I was just literally sitting there and I was like, I think I can do this. And ever since then, I just literally just started learning more about dentistry. And it just, I love science. I'm really like a geek in that way. I love biology. I love chemistry. I love all that weird stuff. I love surgery. So it just became more and more as I went throughout my life and academics. It just made more and more sense for me that it fit my life and what kind of world I wanted to work in career. So I don't have any dramatic story. I really do love what I do. It's challenging, as we're probably going to talk about in a little bit, but 90% of it is great.
Oh my gosh.
Most of it is great. Yeah.
But I think your story
Yeah.
is very valid because
Yeah.
you started going at 12 years old, which means that you knew what was going on and you were
Yeah.
very observant to your
Yeah.
environment and the
Yeah.
people and that were working on you. So
Yeah.
I think that that is a good story.
Yeah. I mean, it just doesn't have such dramatic a beginning, but I mean, in terms of feeling like I made the right kind of decision,
Yes.
I still feel that way.
Oh
Yeah.
my gosh, that's
Yeah.
amazing.
Yeah.
I'll just share like a little brief just because of what you said of falling
Yeah.
on the floor.
Yeah.
So at I believe I was 13 years old. I
Mm-hmm.
fell on the tile floor in my house and I chipped number 8 in sisal.
Oh.
Okay. And I looked in the mirror and I'm like, I'm never gonna smile again. I was this like dramatic teenager. And
Yeah. Yeah.
my mom was like, you can go to the dentist and they can fix it. I was like, it's unfixable. I was like, I thought my life was over. Okay.
I love
I
it.
go to the dentist and he looks at it and he goes, easy fix. He repairs the incisal. It's still, I'm going to knock on some wood. This has still
Still
been
there.
same one from when I was like 13 or 14. Yeah, I think it was 13,
Wow.
14. And from that moment on, I was like, that was magic. Like, this is magic. It's
Wow.
not a
Wow.
crown. It's, you know, and so I just started being more inquisitive every time I went in for a
Look,
cleaning.
we're like the same. We're like the same. That's
It's
awesome.
the exact line you said when you said, I think I can do this. Same line, same
Yeah.
exact
Yeah.
line.
Yeah.
So,
Yeah. And I mean, I think it's so great because one of the things that I say to people all the time, when I was young and I knew that I wanted to be a dentist, I remember calling my dentist and saying, oh, I want to come and shadow. And they were like, no. So yes, so my own dentist. So now anytime anyone ever asks me if they want to come in and shadow, I always do because it's so important for me to like allow someone else to get that experience before they go to dentistry. Because really, even I'm telling you my story, when I went to dental school, I had no idea anything that I was doing or getting into. I mean, I had general ideas, but I had no idea what it really was about at all, especially from the perspective of working there, not going to the dentist, you know?
right. It's a completely
Yeah.
different ball game. Going
Yeah.
to school, learning the head and neck anatomy, like to the, you know, facial nerves and everything. You know, when you think of dentistry, you think of fillings and crowns and implants,
Yes.
but
Science.
yes, there's so much more in depth behind that we need
Mhm.
to know the nitty gritty. And yeah,
Mhm.
so it
Yeah.
is kind of a surprise when we go to school for it and we're like, what
Yeah. It's a
the heck?
huge surprise. A huge
Yes,
surprise.
yes.
Yes. Yes.
So you have a very helpful and desperately needed approach to the dental visit. And what
Mhm.
experiences have you had that led you to creating the method to a positive dental experience, your
I'm,
course?
it's interesting when we met and we were talking a lot about like industry things, talking
Yes.
about like from a dental hygienist, what experiences you have working in an office career wise. And unfortunately, a lot of people have had that experience and so have I. But what we miss a lot is that there is a collaboration that's happening between the dentist and the patient. And that collaboration, not just like I need work and I'm going to do it. That collaboration is also for a relationship of trust, right? A relationship of positivity, a relationship of exchange. And what I find a lot of times, and I've had more experiences than I can tell you, of people who come into the dental office petrified, okay? Everybody or 99% of people come to the dentist with some sort of angst or anxiety. Even when I go, because I have to go too, I'm like, I don't really like, but some people have that a little bit more. But people's expectation is that the dentist, the hygienist, the dental assistant, the dental staff is going to be the one to help them to jump over all of those fears and get to do their work. And the reality is it is very, very, very difficult for any dental professional in any capacity to help someone who is so afraid that they can't even allow you to do it. So for me, when I created the method to a positive dental experience, it's not just to allow the patient to now introduce themselves to the office, know what to expect, know how they can behave and to be a good patient, but it also creates a better experience for the professional. So even though it's written in for the dentist, the dental patient, it's really something that will benefit everyone, because now you have a calm person, you have a confident person, you have someone who expects to have a positive experience, someone who wants to have a positive experience, as opposed to somebody that you're trying to convince them and bribe them and do all kinds of things in order to show them that what they're doing is the right thing. So it's really like, even though it's on this side, it's really supposed to be holistic. I hope, because I'm still practicing dentistry, that anybody who takes this course, man, that's going to be such a better patient, right? Compared to someone who is so full of all this negativity that I have to jump over, even just to do a filling, right? Just to do a cleaning, right? Or just to have a conversation. So for me, that's really what it's all about. It just is an easy way at home that you can go through this material without a dentist in your face and your mouth poking you with anything. So you can start getting rid of those things, you know, before you actually get to the dentist.
You know, I like how you mentioned that they can do it at home, because that's where, you know, people feel comfortable. It's an introduction into whatever, you know, they have to do for their dental treatment, and they can do it in their own time. It's not like it's going to eat up the first 20-30 minutes of, you know, the appointment, which, you know, sometimes we don't have time for that. We have to get that injection in, and so we can get going.
And what you said is it. The dentist doesn't have time for all of that.
No.
The dentist doesn't have time to sit down and go through the whole philosophy and why your teeth are so important, and all of these things that surround the lifestyle that comes with having a nice smile, right? I talk to my patients a lot. I probably spend way too much time because I'm behind, right? But I spend time when I can, really, because people cry, you know, people get emotional, people feel embarrassed. I mean, I had a patient on Friday, her veneer came off in the front. She didn't even want to smile to show me. So people, you know, they feel embarrassed about maybe even the state of their mouth. So it's really hard. And it's like so much compassion we have to give, but we have to do it quickly, right? We have to build rapport. We have to say, we're going to be kind to you. Don't worry. All of these things really, really fast, and then get to it because we're on a schedule. So like really expecting from the dental perspective, the patient to be able to jump over all of that really fast. And for the dentist to be able to magically wave all of your fears away, it's just really like unrealistic.
Right.
Yeah.
So as a dental hygienist of over 10 years, I can absolutely say everything that you just mentioned is something that we deal with, not on a daily basis, but on an hourly basis.
I knew you were going to say that. I knew you were going to say that. I was going to say moment by moment, patient, because guess what? The patient that was on 8 o'clock doesn't know that you had a hard 8 o'clock patient who was giving you a hard time, didn't want to open. Oh no, that it hurts. So I'm scared. Oh no. And then 9 o'clock, you're going to do it again.
Yep.
10 o'clock, you might do it again. 11 o'clock, you might do it again. So yeah, you're absolutely right. That's the tough thing. That's a tough thing.
And when it's like that, I have found that it also, it takes a lot of our mental energy, but it also physically can cause us to use more energy. Like if I have to pry a patient's mouth open, this is all sore, like my biceps are sore. Like I did my workout for the day. I don't have to do upper body because I did it all day prying these cheeks open.
One part of my course, I talk about why is dentistry so scary? Why is it so difficult? And one of the main things is that we are working in a dark, small, wet area that you have to break your back to get inside of. So here, patients in an uncomfortable position, trying to do all kinds of maneuvers in order to get to the area. You're doing all kinds of maneuvers. Things are slipping and sliding. It's wet. It's bloody. It's this, it's that. So here we are on both sides, really trying to make something work. And the more cooperation, if it's only one-sided, if it's only the hygienist, if it's only the dental assistant trying to help you to be comfortable and you're not doing anything to be comfortable, it's so much more difficult. We can make it work. We do it every day, right? We're used to that. We're accustomed to that. But what if there was a whole bunch of people who understood what you're saying? That, man, my back hurts. Sometimes when my patients, they come in and I say, oh, can you put your chin up? I say, my back says thank you, you know, because it's true. It's true. My back says thank you. Now I don't have to crook my neck to try to get to something, but we're doing that all for the patient's benefit. We're not doing it because we want to hurt. We're doing it because we care and we want to be able to get to your mouth and do. And so even the negative mindsets that people have that dentists are there to hurt them somehow, or that once you start to change your mind, and really a lot of the spiritual things that you're talking about on your show is really in line with that. It's really, that's why I was like, this is a great mesh, because I know you talk about those kind of spiritual mindsets. When you start to change your mind, why am I going here? Are they there to cause me trauma? Are they going to help me? Eliciting gratitude inside of you. Oh, what a difference that will make to your procedure. It may not seem like a physical thing, but just changing the way you think about where you're going and why you're going, that already can change how you feel in your appointment.
Wow. Where do you think that fear and anxiety for the dentist comes from? Because
I love all of your questions so much. Can I say? It's so many places. Society basically perpetuates that all the time. Okay. Oh, it's so hard, like pulling teeth. What do you know about pulling teeth, right? So like all of these little things, these parents do that to their children, movies, televisions, stories of past people who tell you about things that have absolutely nothing to do with you and your own imagination, right? So all of these negative things, we put all of them together and then we make up these stories, most of which are not true. Most of the time when I see a patient, I say, because I make jokes with my patients, I'll say, there is no way that I can live up to the terrible thing that you have created for me. Like, there's no way. Whatever you didn't sleep last night about, I'm not going to do that to you. You made that, you tossed and turned all night dreaming of this dental appointment, probably just a filling or something, right? But to them, it was like something terrible is going to happen. I'm not going to live up to that. I'm not going to do that. Half the battle is just getting people to come because they're so afraid. They've already imagined all the terrible things. They're not even going to give it a chance, you know?
It's so true. And when they come in the chair, we just want to come in and be our best self, right? And so I think that the method to a positive dental experience is so crucial and it's so needed. It's so unique, and it's first of its kind. And I think the more, I don't want to use the word patience, but people, because we're all patients, right?
Friends.
We all have to go,
it's
need
true.
this. It's so needed.
And it was when the idea came to me, I started to search like crazy. I was like, there is no way somebody else hasn't done this. Like, there's no way I'm coming up with it. Like, somebody has already made a course for this. It's impossible. And I could not find it because most dentists are more concerned with bringing a patient into their personal office. I am not concerned about you coming to my office in particular. I tell my patients, and you're a hygienist, you're going to know this is so true. Oftentimes I'll meet somebody who has periodontal disease. Oh, I had scaling and root planing. I hope I'm not talking too technical for your audience. I don't really know.
No. So scaling and root planing is deep cleaning. That's what
deep cleaning, everybody.
That's what you guys would know as a deep cleaning. But we do have other dental professionals that do listen. So we have a mix of both.
Awesome. So like somebody will come for a deep cleaning and I'll say, well, it's important that you keep up with it. Even if you move to Iowa, even if you move somewhere else, you have to know, I need to get my cleaning every 3 months. I need to get my cleaning every 4 months. It doesn't matter. What is it for me to hold that information for you? So now you become a part of your healthcare journey. You become an advocate for yourself instead of only what someone tells me. Then you become empowered and you know, it doesn't matter where you go. If you're seeing me, God forbid you don't live in Florida anymore, you have to live somewhere else. It's not only me who can give you a positive dental experience. You can carry those things with you. Once you start to like put some responsibility on yourself, not in a negative way, not like, oh, it's your fault, more like responsibility, like this is my mouth, I care about myself and therefore I want to go to the dentist. Therefore, I want to be a compliant patient. I want to get my work done. It's different than being convinced, right? Totally different.
It's almost like ownership too of your own mouth. And something that I found that can help bridge that connection sometimes. And, it's not cookie cutter. It's not every patient is the same. But sometimes when I'm explaining things, I'll actually grab a mirror and I'll say, look, this is the recession and this is because you're brushing too hard or this, and I show them, I'm like, and this is something you can keep an eye on at home as well. So it's ownership. It's not just me doing,
Yes.
doing the probing and recording
Yeah.
every visit. It's also
Yeah.
you watching in the mirror at home to check on it,
Yeah.
for
Yeah.
many different things, not just recession,
And
but
you're always going to get a better result when you're doing it for you. You
yes.
can't do something. I mean, this has nothing to do with dentistry only. You can't only do something for someone else. You have to be doing something because for you, you see the payout. You see the positive payout. You know what I mean? It's not, oh, Dr. Dennis made me do it. It should be for you. And you should feel convinced that this is an important part of your life that you should keep up. And if something is, if there's a part of your life that's getting inhibited, you can't get a job, or you feel like you don't feel confident dating, or whatever it is, it has nothing to do with just teeth.
Right.
Do you know? So everybody is just kind of convinced that it's about the dental office, dental office, dental office. But what happens when you leave, you go to eat, you go to smile, you go to networking event, right? And you're shaking hands and you want to be confident. That's what it's really about. Whatever that pain or discomfort is, really temporary to get your goal. Nobody wants you to live in a dental office,
Yeah.
We're not making you comfortable there, but we want it so when you go there, you could get a positive outcome so you can leave and go live your real life, the stuff that really matters to you outside.
Wow.
Yeah.
It's so true. It's not just in the office. It's a lot of the anticipation before the visit. And then, like you said, is your smile affecting other areas of your life? And for many individuals, it is. And a lot of it is that fear. It's just it's fear. And I love what you said before, whatever expectations they had, the night before, you're like, I can't even live up to that. Even if I tried, I'm not going to hurt you.
No.
None of, no.
It's so, I think I told you this when we met. When I started to write the course, I felt like it was pouring out of me. It's like almost like everything that I never had time to tell a patient. Like I wouldn't be able to go and break down all of these things to them. Like even in my course, we talk about like what clothes you should wear to the dentist. Those are things, it may seem very unimportant to you, but when you hear it, you'll be like, maybe I don't want to do that. Or maybe I do, but a lot of that is really about confidence. Like once you start to know, like, okay, what am I going to expect? What's going to happen? What should I do? What should I bring with me? What are they going to say? What kind of procedures? It makes you confident. And really that confidence will literally kill your fear. You start to become confident, you won't be scared anymore. I was listening to your episode about meeting me at the Boss Babes event. And I know, I love it. Don't worry. I love it. So I was listening to it and how you were talking about talking to yourself, like talking to yourself. And sometimes we don't always have someone to encourage us and say, go, you can do it. Sometimes you have to look in your mirror and be like, girl,
do it.
I want to do this. So let's do this. I have done that a million times, and you have to pep talk yourself. And after the first time, you might do it and say, oh, I got to do it again. And you'll do it again. You have to keep picking yourself up over and over again.
Absolutely. I mean, the Boss Babes brunch was so incredible, but just the fact that me and you connected, or you and I connected, it was so special for me because we were able to communicate very quickly and we understood each other. I was like, get out of my mind. Like we understood exactly, our unique. I'm saying unique because, it's not like we can walk up to someone and really explain what goes on in our day. It was like, what are you talking about?
What are you talking about? And not relatable. And that's why I think even more you're so interesting, because what you have done, correct me if I'm wrong, is you've shown another avenue for dental professionals, right? Yes. So like there's more than just this. And this may be great, but there's a whole world and different opportunities. And even in different phases of your life, maybe you have something else. I'm doing this course right now, which I absolutely love. It gives me a platform to talk about it. But at the same time, dentistry is not everything that I am. I'm much more than that. I don't just, all my knowledge base is just not in one place. And just kind of giving dental professionals like permission to be like, well, I have other things about me that are great. I have other things to offer the world instead of just I can clean teeth or I can fix this or I can do that. There's much more to you. I love that. I think that's the part that was like bing, bing in my head.
Oh my gosh, thank
Yeah.
you.
Yeah.
It really became apparent to me that I could be more than a dental assistant and dental hygienist when I said, wait a minute. At age 18, I went to school and I decided I was going to do this, but I'm still a human being. I still
Yeah.
have goals outside of my 9 to 5. And I kept trying to push it away. Society says go to work, and then go home, cook dinner, watch TV, and go to sleep. And so I was on that
Wheel.
for a decade, for a
Yeah.
whole decade. But in the back of my mind, I always thought, what if I could do something else?
Yeah.
And I was always told from family, friends, basically my community, shut up. What are you talking about?
Yeah.
Go to work and
Yeah.
zip your lips. And I
Yeah.
was,
I think that also because you, how do I say this? You already get a certain level of prestige where you are. So everybody's
mm-hmm.
gonna be like, what are you complaining about? That's a great career. A lot of people would love to have that career. Like, so what are you complaining about? But like I said before, when I went into dentistry, I had no idea what I was getting myself into. And I'm a business owner. So yeah, I mean, we could go on for days. We could go on for
Exactly.
days as to the surprises that you encounter, as to things that you're like, I have to deal with that, and I have to deal with that, and it doesn't. 20 years will pass and it'll probably be the same, like things you have to challenges. Your experience doesn't like say, oh, I've been doing this for 10 years. Now I've been doing this for 10 years. You don't have to deal with that anymore. That's not true. That's far from true. You're still going to have to deal with it. And yesterday, very funny, I have a patient, she's a massage therapist, and she says to me, she's leaving massage therapy. And I said, why are you leaving massage therapy? She said, because I feel like I take on the energies of the people that I massage.
Wow.
And I said, I almost said her name. It's so funny. I said, that's why we all, especially in professions where we have such close interactions, we have to stay above their emotions. So somebody could be super chaotic, angry, all kinds of different emotions, but you have to stay even, because you can't go up and down. Like you said, 9 o'clock, I'll be up, down, 10 o'clock, 11 o'clock. You'll be emotionally a mess. If you go up and down with everybody who comes in and out. Listen, I go to lunch and I'm like,
I used to have to meditate on my lunch break, go in my car and close my eyes because I had so much angst and just like nervousness, I guess, from hearing all of it hour after hour. And to be honest, it's kind of like hurtful to be professional. And the patients don't mean to do it to us on purpose, but we still feel it.
And we don't just feel it once. That is the thing. It's a compounding effect. It's like, okay, I felt it, I got over it, but you have to feel it again. And you might feel it tomorrow, and you might feel it the day after that. So emotionally, and we're women, I don't know how the men are doing it.
Right.
Maybe they're doing it much better than us. I don't know. maybe they're like, what are you talking about? No big deal. But we're women and we're sensitive too. It's very difficult sometimes not to take it personally. It really is. It's hard. And I don't think, because they're the ones sitting in the chair and they're the ones that are experiencing all the negative aspects, because we're the ones doing it. Like you said, like I said before, like the sympathy on our end, it's very low, but it's hard for us too. Hard for us emotionally, hard for us physically. And literally, if both sides just had a little bit more compassion for the other side, oh my gosh, what a better experience we all would have. What a better experience we all would have. Just a little compassion, just a little bit.
Absolutely.
Yeah.
Something that patients would say, and tell me if you've heard this, I'm sure you have. If I'm like, oh, if we're doing, I don't know, a sealant or anything, it doesn't matter what we do. And they're like, I'm like, you'll be okay. They're nervous. They're like, easy for you to say, you're not having it done to you. I'm like, but, and it's a big
all the time. Yeah.
I'm like, depending on what's happening in the office, I'm like, listen, whatever you are having done, I've had it myself. We were working on each other in dental school. I know how it is to have an injection, and it might, whatever it is.
Yes.
I'm like, listen, I'm
human. And sometimes that makes them feel better, and sometimes that doesn't.
No.
But it's just really like, like I said, if we had a moment of compassion for one another, we would change our whole perspective. Like if your loved one came in and you were the one treating them, they would have more compassion because they're like, oh, I know what you go through, like they would have more compassion. But most people, they don't have any idea. They're like, ugh, I'm the one suffering here. Who cares about you?
Yeah.
It's true. It's true. But that's why I think another thing, that's why I think it's so important. And you tell me, like I said, when I made my course, I looked around, I didn't really find anything like that. Like for you, do you see support of other dental professionals? Like, do you see that support, like to talk about these challenges, to talk about the things that are hard? Do you know, like, have you seen any of that anywhere?
I have not. I have not. And that's
You're
why
the first for me. Yeah.
well,
Yeah,
that's
you're
why
the first that I've seen.
it's put so much pressure on the dental professionals. So your course is like, I'm so excited for it. And I'm so excited for the world to hear this so that they can send it to their friend, coworker, family
Yes.
member, everyone, because
Yes.
it's really needed. And
Yes.
not just because one person feels this way. No.
Yes.
It's a large,
Lots of people. And I have a YouTube channel. I've had my YouTube channel since 2017. And most of my videos are all about like dental fears. And all of my comments are, it's so interesting. Most people are like, they will be commenting while they're in the dental chair. They'll be like, I'm in the dental chair right now and I'm so afraid, like literally. And I'll comment back and everything like that. But that's true. It's like so many people, they like searching for something, searching for. And I love the way, because I've seen the internet grow because I'm older, but I've seen the internet like change to allow people to find little groups of people that they can find some sort of care and camaraderie, like all these niches. It's like dental professionals who have had a hard time at work. Yay, something for me. Like all of these things that can really, like somebody who speaks your language and somebody who understands what you're talking about, knows what scaling or root planing is,
yes.
and all of those things, it matters. It gives you, it makes you feel like you're not alone. And I think so many things, even dental fears, or if it's working in dentistry, so many things are, when you feel alone, it really, it makes it sadder.
Yeah.
Like when you feel like I'm the only one who feels this way and I'm the only one going through this, it just makes it much more difficult.
It's true. At the end of the day, when we're home and we're in our house, and naturally we reflect on the day that we had. And like you said, it can feel very lonely.
Yeah.
And having a community of, professionals that understand exactly what you're going through is so clutch. It's so needed.
Even just to vent, just to say, like even me, if I come home and I try to tell my husband some of the things, like, I don't know what you're talking about, like, I don't know what you mean. So it's like, even just to have that, it's like, oh, somebody knows, somebody gets it. Yeah, somebody gets it. And already that's the therapy right there. That's the therapy right there. Somebody gets it. Somebody understands. Somebody's not judging me, or, it feels better that way. Yeah.
So tell me, what do you think is the mind, body, spirit connection to a positive dental experience?
Well, it's all about the mind. It might be mind, body, spirit, but it's all about the mind. I consider myself a very spiritual person. I approach life that way. I don't necessarily say some of these things to my patients about like law of attraction, how I feel about my spiritual journey, but I definitely feel like one of my huge things is like how we think. And I think that I even came up with this course because I'm always listening. Like I'm listening to people. I'm listening to the things they say. Everybody thinks they're saying something different, but everybody's saying the same thing. And so like the mind, body, spirit is really just like, so in the mind, I really spend more time probably breaking down all the things that you think, or the things that you have lied to yourself. So I call it myths, misconceptions, and misinformations about dentistry that has caused you to be afraid because they're not real and they're not true, right? So once you get rid of, for example, this sounds like a silly one, is that you can fix things at home. So people do all kinds of, thank you, TikTok. People do all kinds of things at home to avoid going to the dentist. So people are willing to put rum on their teeth, and I know you've heard them put aspirin and rinse
nail
with
file.
Oh my God. Everything, just because they are doing everything that they can. So just kind of getting rid of all of these things, like I can oil pull and get rid of my cavity. Do you know, like, so people do all of these things in order to avoid going to the dentist. So I spend a lot of time like breaking down the negative things, because, you know, like in any mindset work, before you can even plant good seeds, you got to get rid of the garbage. And so you have all of these, like, the dentist is trying to take my money, they want to hurt me, and you have all these things. How on earth can you put anything positive on top of that? So just kind of getting rid of that with plain old logic, really. Because when you start to talk about it, you see that doesn't make any sense at all. Do you know what I mean?
Yeah.
Yeah. So once you start getting past those negative things in your mind, you can start saying good things to you. Like, I'm happy to be at the dentist. I'm glad that I have the money, right? That I can even go. There are people who don't even have access to anything. So just having gratitude in your heart and just thinking that this person wants to help me, changing your mind. So everything after that, once you change your mind, the other things will flow naturally. The things I talk about in the body are just tips and tricks to help you get through the appointment. And then the spirit is basically how to keep going. And you know this too. Lots of people start and do not finish. Lots of people do one appointment or just go in. They hear something and they hightail it out of there and they never come back. So once you start to get the staying power, so you get the right mindset, you're prepared in your body for what work you're going to do, and you have the staying power to finish. That's really what it is all about.
Wow, that was such a comprehensive answer.
You know why? Because I've been thinking about this so much. I think about this so much. I'm so excited about this information. So it's in my head all day.
You know, it shows, and it shows that you have compassion for, it's really like we have compassion for our neighbors, right? We care about the person. That course is not only, like you said, for the patients coming into your office, it's for every single person who is going to visit the dentist. And so it's so beautiful.
Yes. So yeah, that's what it's all about. I'm so excited about it. I feel like, if I could say, like kumbaya, the world to be a better place, that's what it feels like to me when I think about it. I think about like how we can also all be in a better, loving, more caring space.
If we could all love each other a little bit more, it would make the biggest difference. I talk about that because it's even little things like at the grocery store, like anywhere that you go. And you know, I used to think things were about me, right? It's all about me. No, that's the ego. But when we put the ego away and we think about, you know, why was that person nasty to me? And I'm like, wait, they weren't being nasty to me. You know, Dr. Dennis, Christina, you know, it wasn't to me. It was what they're feeling inside.
And when you take that extra moment and you say, look past the behavior, and that's our job, right? As dental professionals, we're the ones looking past that behavior over and over again. That can happen from the patient's perspective too. They can take a moment too and do that. Oh my gosh, I see you're behind. I know you had a hard day, right? That exchange of compassion. Oh man, what a difference. Look, we'll have a better experience just together if both of us do that. But like, I find that all the time, especially with dental fears, people can present them angry. People can be snarky. Like I had somebody the other day and she was just embarrassed. She was being a little catty, but she was just embarrassed. And it's like, once you get past that, then you can say, oh, you know, I kind of liken it to like when you have children and your children are sleepy, but they don't know they're sleepy. And so they start acting really out, but it's really, go to sleep and you'll be fine. So people show their fear in so many different ways because they don't know, you know, they don't know what they're really feeling. So if you, as a higher minded person, you as somebody who vibrates on a higher level, if you can put away your ego, right, and look at them like that, then you can find, oh, okay, you know, the whys, you know, and then you'll just change your whole attitude towards them. Yeah.
So true. Do you have a favorite like mantra or quote or affirmation that you like to say? I'm so curious.
I don't. Do I have a favorite mantra or quote that I like to say? Oh man, I should have thought of that ahead of time, huh? Any quote I give you is going to be like super dental and it will not be good.
I mean,
let me think of a quote. Man.
While you think,
yes.
or I can, okay. So
you're gonna give me something?
Well, I have one. So I was thinking about it the other day and kind of going back to when we were talking about when a patient comes in and they have a lot of negativity in their mind, how are they supposed to have any room for positivity?
Yeah.
And trying to think, I don't even know where I wrote it down, probably in some notebook. I don't have it here. Yeah. But the quote says,
you're just like me. I'm trying to remember my quotes too.
Well, it was really impactful. And I want to say word for word. I don't know word for word, but I'll give the concept of it. It says that there's always, when you're thinking, the mind is always going to be full of something. So in order to make room for something positive, you have to take out the negative for there to be room.
Absolutely. Absolutely. I hope you remember it because that's a good one.
And I wrote it down.
Southern people say you can't fill a full cup. Is that? Yes. Have you ever heard that before? I think it's that the same way. You know what? If I had to choose a favorite quote, and I don't think this is a quote, I would say mind over matter. A lot of times I'll tell my patients that it's all in their head, but it's not all in their head. It is in their head, but it's not in their head, right? Because literally I am working in their head, and I'm not saying they're making it up, right? It's not like, well, it's all in your head, you're making it up. It's really all about the way you're thinking about it, right? If the way that you're thinking about it is a bad way, it's going to be bad. I'm sorry. I'm going to have to like really convince you that it's not bad, but it really is all in your head. And once you know that, oh, I learned that in my life all the time. It's not just dentistry. I learned that all in the head. My perception, literally, I could be going through this same exact day. Nothing has changed. And I could be in a good mood and I can be in a bad mood. What happened? Nothing, no difference except me changing my mind. So if I know that, then I can choose my day. I can say, you know what? I want to have a good day. And guess what? Just like I'm sure you know, you could say, I want to have a good day, start your day off great, and something can come and try to derail you, and you can go and look in the mirror again and put yourself back on track. So you can be your own cheerleader that way, but it's all in your mind. It really is. It's not just dentistry. It's your life. Everything that happens around you, it's literally, your car could crash and you'd be like, oh, that's good. I'm glad I could get a new car now. Right? You could say that, or you could be like, dang it, like it's your perspective. It's how you see the world is going to affect everything.
Wow. Yeah. I just, that's deep because it's true. It's not just related to dentistry. It's the whole world. It's our whole life. It's our whole life.
Yeah. Yeah.
Wow.
It's like, that's what I said. Like when I say a positive dental experience, I'm like, well, what doesn't that apply to?
Yep.
What do you have in your life that if you enter in with negativity, like you're going to get a positive outcome? Like you're already downing it. If you went to a restaurant and you said, oh, this food is going to be terrible and I'm not going to like it and everything like that. I mean, what's the likelihood you're going to like the service
you won't.
You will find reasons not to like it. So once you know that, man, everything can be whatever you want it to be.
Yeah. Wow. So any last words for the audience? We are going to just wind down a little bit here. Any last words? This was such an incredible conversation, but
I loved it. That was awesome. What would I say in the audience? I mean, I think that when we think about wellness, obviously I'm talking about dentistry in particular, but wellness is holistic, right? Wellness is not just teeth or skin or, gastrointestinal, whatever your body is doing. Wellness really starts in your mind. And once you want to be well, once you want to seek that, you are going to be well because you are going to pick all those things that you need to do to smile, like I said, to be social, to network, to do a video, to do a pod, whatever it is that you need to do, you will collect those things that you need to do in your life so that you can be a whole, well person. Listen, if your teeth are great and you're not scared of the dentist, great. Find something else that you need to work on because you're evolving all the time, right? So it's wellness, it's wholeness. And who are you doing it for? Only for yourself. So if I say that, I mean, yes, teeth are important. And when we were in dental school, really quick, when the dean, she says, well, it's just teeth. And remember, it's just teeth. It's just teeth. Right. And the end of the day, it's not a big deal. It is, and it's not. Right. So it's like, how much weight do you put on it? But just take care of yourself. I think that at the core of it is what I would love to see people do. That means going to the gym, go to the gym, whatever it is that you need to do, take care of yourself.
Wow.
Yeah.
Thank you.
Yeah.
So I'm going to put the link below in the show notes for the Method to a Positive Dental Experience. So everyone go and check that out. If you or anyone you know is anxious or has a fear of going to the dentist, please send them this podcast in a DM or text it to them. It only takes 2 seconds. In the course, The Method to a Positive Dental Experience, Dr. Dennis guides you through mind, body, and spirit modules, slowly and truly, so you will feel your old negative perceptions of going to the dentist melt away, showing you how to put away all those dental fears and replace them with the Method to a Positive Dental Experience. The method is the best way to truly face your dental fears and start smiling again. So I always like to end the episodes with an inspirational quote. And today's quote is, every time you are tempted to react in the same old way, ask if you want to be a prisoner of the past or a pioneer of the future. Deepak Chopra. So if you're listening to this podcast, I know that you are a pioneer of the future. That means that learning new concepts and innovation. You deserve the life that you've been dreaming about. And so with that, I wish you a beautiful day and I will see you on the next episode. Dr. Dennis, thank you so much for being here.
Thank you, Christina. It was awesome.
Bye.
Bye.